To the member for Hasluck.
Deputy Speaker, I rise to speak on the motion put forward by the member for Dawson, Mr Christensen. I think this is a landmark situation in which we have the opportunity of working not only on a bipartisan approach but a tripartisan approach, including every member in this House. What I find frustrating in the way in which sometimes governments do business is the way we make announcements that make it seem as though the program will be rolled out this year, that the immediate impact will be in the very near future. But when you read the fine print, you find that it is July next year. You find that the amount of money is not sufficient to cover the expectations of all of those families that are affected. In my electorate of Hasluck, I have a disability services forum in which I have a number of parents and caregivers on that who give me an inkling as to what they go through on a daily basis and what they hope will be a major reform by the Australian Parliament in respect to the provision of services based on need to those who have that requirement. And you talk to carers and their job is a 24/7 job. Their hopes and aspiration for their child or the person they care for is no different to any other parent, but they know that they have some challenges. They know and have raised with me the issue of what happens for post-secondary schooling. What jobs can my son or daughter undertake? And then what are the services that governments will offer? And I want to acknowledge quite openly the states and territories who have, for several decades, have been at the forefront of providing the services that people currently access. I would have thought with the NDIS that we would have seen a genuine commitment to the full level of funding at a much earlier point in which we could provide the level of support that these families and each individual needs. I know one of the other great challenges for them is what happens to my child when I die. Who's going to look after them? Who's going to give them the care, consideration and love? And that tripartisan approach is absolutely critical if we are to roll out effective support services that meet the needs of individuals. I had an experience of meeting with 60 carers and I had them speak to me for 3 minutes each about their context and situation. And at the end of that, I had a heart that was heavy for the pain that they experience in the uncertainty in access to services, the uncertainty of the future of the person that they care for. And I would hope that we don't see any proposition for a committee as being an impediment, but like the committees that have been established to deal with the Murray River context, the committee Deputy Speaker that you chaired, that it is a bipartisan approach of genuine commitment to ensuring that all those Australians who have need of the NDIS have the NDIS, that we look at real funding that will provide the services. We don't give a false sense of hope because the disappointment for many will be very bitter. And certainly in the people that I interact with within my electorate and outside of it, the expectation that this Parliament, and that's all of us, will deliver an NDIS that will meet their needs is going to be shattered for many because the trial sites are only in certain locations. And certainly I know that our own Minister with responsibility for this, the Honourable Helen Morton, who is the Minister for Mental Health and Disability Services, has made a strong commitment to all of the groups I've been to where she said that the state will not abrogate its responsibility and will continue. Premiers came with high hopes and expectations to COAG, but were frustrated with the lack of detail. I think it is important that the Prime Minister, in her dealings with leaders of the states and territories, has an open and frank discussion that allows for compromise, allows for flexibility, because no one-size model will fit all, but certainly we have the capability and capacity to deliver something that is real and meaningful to those who are affected. And I will feel a sense of frustration for those in my electorate who I know are unlikely to get those services, because based on the interview I heard the Minister Macklin have on Adelaide Radio, then some of the definition around the degree of disability has not been finalised, and I think it's a long time coming.